Hello guys. If you're seeing me for the first time, this is Sapphire Adeze, and this show I talk about health, well-being. I talk about politics of great concern, and we make weekly declaration every end of the week. Like today, I've done a weekly declaration. So today we're gonna be addressing our new mothers. Last week I talked about the pregnant mothers, our expectant mothers, mother to be. So today I'll be talking about our new mothers. Yes, new mothers, and how they struggle with their baby concerning teething. So, if you're seeing our video for the first time, please try and subscribe, like, and share. It doesn't cost anything to share, it doesn't cost anything to subscribe, and it doesn't cost anything to like. That will help us to know how we're doing and what we need to put in place. And also by sharing, you'll be reaching a nursing mother who is in, who is in struggle on how to look after the baby. Today we're going to talk about teething. Yes. So what is teething? Teething. Teething is the time when your baby teeth start to push up in the gum. When the teeth start to push up through the gum, that is when teething begins. And this is usually from the fourth month. Some babies start from 6 months, even some 1 year, depending on child. It is normal. Everybody have their own time and pace. It is normal. No lateness, no rush. It is normal. And in some babies, when this starts, they present in with so many symptoms. Yeah, it comes with so many symptoms. What happens is that inside the gum, the tooth is like a little plant trying to shoot up. And when this is happening, what happens is that the baby, it encounter a lot of pressure and forces. And when this happens, the baby start feeling pain. That is why you see some baby, they become irritable, they cry, they feel so many how will I say, they feel irritable. Yeah, they feel irritable, they cry. And as a young mother, inexperienced, you'll be panicking, you feel frustrated. What's happening to my baby? Why can I not help my baby? My baby is crying. How can't I help? Yes, it's understandable how traumatic this can be. Yeah. The first teeth that usually come out is the two lower teeth. Next, the top one, then other ones. So, is teething is a process that can go up for a couple of years, not 1 month, not 1 year, until we even have the one they call the wisdom teeth. That is when people have grown up. Now, what is the symptoms that you experience when this is happening? A lot of salivas will be coming out of your baby's mouth. The child become salivating so much. Yes, it is normal. What you do is that you help the child to clean up. Most of them at that time, you see some mothers complain that, oh, my baby is biting my breast. Yes, what baby is actually doing is that because the gum is achy and itchy, the baby is trying to use the breast to scrub the gum. Some babies put their fingers in their mouth. Some of them chew their toy. What they're trying to do is that they're trying to use those objects to scratch the gum, which is normal. And this teething stimulates saliva and causes to produce saliva than usual. So what you do is that when this start to happen and the baby is producing a lot of saliva, get a clean flannel or small towel. Always clean underneath of the baby's neck so that these salivas will not produce rash around there, because you will have what we also call moist lesion. When saliva starts staying there, especially like the well, I say fatty babies who are ploppy, big babies that have folds around their neck. When the saliva gather there, they might develop moist, what we call moist lesion. So, or some children develop rashes. So mothers, you take flannel, you clean. Baby will be salivating because it's the force of at which the teeth is trying to push through the gum is causing increased salivation. It is normal. So yeah, that is expected. So there'll be constant wetness around there. Number two, that baby is going to chew and bite everything, as I said before. Hand, toys, everything. They are trying to relieve that discomfort that they are feeling. The pressure of biting is actually helping them to reduce the soreness. So give your baby something that is safe to chew so that they can use it to, something you can even put in the fridge or anything that you can clean. You clean it and give to them. Some those things that are from the fridge temperature help to calm the gum. So you see this baby very irritable, crying. Even when you cry, the baby is very irritable. Some mother will say, "What is wrong with you? You are not hungry. I've given you food. You are not wet. You are not this." Calm down. Calm down. The baby is going through a lot of changes. The baby is going through a lot that he cannot express. Okay? So another thing is you see that another thing is that you see the baby reduce appetite because when this gum is achy, the child is irritable, they lose appetite. So some mothers will notice that, oh, my baby is not eating well. Yes, it's expected. Keep trying. Don't get frustrated. Don't get distressed so that you will not compound the baby's distress too. Yes, calm down. Keep offering the baby bit by bit, as little as they can take. Be patient with the baby. Don't feel frustrated. Number five, you might notice that the baby have a mild temperature. Some baby have slight temperature during teething, but not fever. Just slight temperature rise. What happened? Let's address the things teething does not cause. Because some people think that teething cause a lot of things. Okay. Now, we're going to talk about what teething does not cause. One, teething doesn't cause fever. If your baby temperature is 38 degrees Celsius and above, using your thermometer in your house if your baby have a high fever, know that something else is going on, like infection. Don't put the blame on the teething. Take this child quickly to see the doctor. I also want you to understand that teething doesn't cause diarrhea. Some people will say, my baby is teething, that's why it's having running stomach. It's a lie. Diarrhea is something that appears during teething age and usually caused by infection. Remember, I mentioned that baby is picking different things to scratch their gum. Those things that they pick to scratch their gum that might be dirty introduce germ into their body. So if your baby have bacteria or is tooting excessively, go and see your doctor. Teething does not also cause convulsion. If your baby is having a seizure during teething, please, this is a medical emergency. See the doctor. Call ambulance, go to doctor, rush baby to the hospital as quickly as you can. Quickly